I'm an optimist. I think we're in recovery, but we also need to be resourceful in that recovery and be aware, because there's going to be another trauma. There's going to be another disaster. And we need to, again, build upon the resilience that we've come out of this other pandemic, those ripple effects, and learn from it and share that with the people around us.
When a disaster such as a tornado, flood, or fire occurs, it's easy for friends, neighbors, and community to offer assistance to those in need. However, the COVID-19 pandemic is a disaster that created ripple effects that are much harder to identify. Mental health is one such effect. On today's Sound Living, the importance of community well-being following a pandemic. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wickman. The Kansas Health Foundation's Distinguished Professor of Health at Kansas State University, Elaine Johannes, says the pandemic didn't hit everyone the same, and that the ripple effects are different, but community plays an important role in the recovery. Elaine, we've talked a lot on this program about mental health, not only in Kansas, but nationally, the problems we went through during the pandemic, and really we are still trying to get back to what we had pre-COVID in terms of just our mental health.
Mm-hmm. Jeff, yes. I think the pandemic did reveal those cracks in the system, not only in our mental health and behavioral health systems, but also in our whole individual system of how do we cope. And I think you and I are keen observers of the people we're around and the communities we're part of, and we notice that there's this ripple effect of, okay, if technically the pandemic, global pandemic is over, the pandemic of anxiety and stress and kind of uncertainty continues. And so I think that's probably where the stress and anxiety comes from. And it can precipitate some really long-term mental health concern and the conditions that people have to cope with.
Is it safe to say that it was a traumatic event that some people are still recovering from just because they're afraid it could happen again, especially now as we get into the colder weather and people start getting colds and the flu and they're kind of concerned about their health again?
Yeah. Okay, let's say on a positive side, and you and I like to look at, let's look at the positive side. People are aware, right? People are aware of what viruses are and what public health could do for us and what vaccination has done for us as a society and a species, So on the positive side, I think we've got a lot of young children who want to study epidemiology when they get older. On the other hand, it was a disaster, right? And a disaster not necessarily based on a natural occurring, a tornado or hurricane. Those are disasters. But this was a disaster that continues to have ripple effects. Yes, it was a natural disaster. Did we see it coming? Evidently, there has been some science around, viruses break out and we're not prepared to deal with them. So it was a disaster that was naturally occurring. And not everybody was hit, though, the same way. And that's an acknowledgement of we aren't necessarily equitable in our health care or health access. So this disaster didn't hit everybody in the same way, nor did it hit the United States like it did in other places of the world. So we found that this disaster, even the ripple effects are different. The ripple effects of, are we aware how well prepared our community is to address these large-scale health issues? Or what about just getting access to food? So the ripple effects of this disaster, I think, have led to what's often kind of considered as the mental health effects of a disaster, a trauma of a community, which actually traumatize families and individuals differently.
Well, and we see that, don't we, across the spectrum in terms of mental health. It's fluid and it does kind of change during the lifespan?
Mm-hmm. Yes, it does. Oftentimes, the children in our lives can bounce back pretty well as long as they're watching adults in their lives bounce back, or at least the adults in their lives being able to cope. And coping are those things around, we know what our emotion is, we can label it. We could say, I'm sad today, Jeff, or I'm happy, labeling our emotion. Also regulating the behavior attached to the emotion, meaning if I'm feeling angry, maybe I don't express it. If I'm feeling sad, I'm able to maintain while I'm at the workplace. The children in our lives watch us do that. The children watch us cope, label, manage. And then throughout the life course, we learn to do that ourselves, right? We learn to manage ourselves. But if there's too much happening and we don't see the models in our lives of people who are able to cope, then we kind of begin questioning our own skills and abilities. And then we do have people who are under severe stress, anxiety, who have a pre-existing mental condition. And there's just so much that people can cope with.
And the social determinants of health really comes into play here, doesn't it? That was one of the things that probably showed up during the pandemic and post-pandemic.
Yeah. Yes. And a social determinant of health would be any of those things in our environments or in our communities that lead to a condition that may be aggravating a health concern or not supporting a mental health concern. That can be employment. So a social determinant of health is working in a place where we thrive and working in a place where we're acknowledged. Another social determinant would be our housing. Do we have adequate and then safe housing? And then if we're in a house or an apartment or a place we call home, is that also our workplace? The other social determinants of health are around education. You know, we saw that with public schools. We also saw that with access to not only health care, but how about healthy environments, a park, water, places to walk? So all those social determinants of health that weren't really stable in our lives during the time continue to have some instability.
We heard a lot about the effects on younger children, preschool, first, second grade, but we didn't really hear a lot about the middle school and the high school students. I'm assuming that they're also trying to work through some things because their lives were disrupted and they missed out on some of those really milestone events.
Yes, you are spot on. So every year, most schools in this state are able to do a questionnaire in school called Communities That Care. And in this state, the majority of school districts back this spring in March and April did do the Communities of Care questionnaire. And those are for children in the 6th, 8th, 10th, and 11th grades. The children in those grades in Kansas schools at that time did report more feeling of depression after 30 days, more concern about their own mental health, more entertaining ideas of harming themselves. And the depression and suicide report is one of the first that the state has done through the Centers of Disease Control. And it's of concern. At that snapshot in time, our young people who completed the questionnaire at school were struggling. The indicators are clear, but I do want to also speak about the children who thrived when they did not have to go to school, when they worked from home. They were self-directed. Some of them found, boy, it was the best possible occasion because they focused and they were able to excel in content and curriculum they preferred. Those children now may feel, okay, I did well there. Now, do I need to be doing well in a classroom? Well, yeah, that's part of social development and emotional development. But the children who did not thrive at home, the children who missed teammates, classmates, friends, teachers, did show and I think do have some concern. Frankly, I see it in my classes I teach at K-State. I have freshmen and sophomore in my classes, and they're a little uncertain too because, okay, they kind of hit their stride when they were not having to report into a classroom, but they missed out on some things too. So it is a really unusual time, and I don't know if we'll see the results of all this in this year. I think this will be a long ripple effect.
You mentioned resilience before. Are we seeing some signs of that resilience build amongst the younger folks especially?
Yeah. Resilience is a really important word. We're hearing it used in a lot of different ways, not only the resilient individual who can bounce back from a crisis or traumatic event. That's what most people think about. But now we're reading and hearing about the community that's resilient. And that resilient community does not have to be a geography. It doesn't have to be a city, a county, a township. It can be a community of friends, a community of workplace, a community of affiliation. That's the word for it. And the bouncing back of a community requires the same kinds of characteristics as bouncing back as you or I. We have to be adaptable. We have to be aware of our own mental and physical state, meaning we have to get a gauge of like, I'm not cutting it really well here. I need a little bit more. We also have to look at the resources we have internally and seek out resources, meaning it's all well and good to say, I'm going to cope by myself, pick myself up by the bootstraps and just kind of handle it. But that doesn't necessarily work when there's so much uncertainty, so much instability. So having resources that we can ask for help, we feel comfortable asking for help, and then sharing that help. And whole communities need to do that now. Can't rely on one industry, can't rely on one leadership group, can't rely on maybe one faith community, one school, one workplace. We have to kind of adjust our expectations to it's everybody and all of us together. And I think we as a people need to also be not just self-reliant, but reliant on everyone. So from resilience comes the opportunity to recover. And I'm an optimist. I think we're in recovery, but we also need to be resourceful in that recovery and be aware because there's going to be another trauma. There's going to be another disaster. And we need to, again, build upon the resilience that we've come out of this other pandemic, those ripple effects, and learn from it and share that with the people around us.
And Extension is playing a role in this as well, right, in terms of community and making those connections and providing those resources?
Yes. Extension is embedded in community. We're part of community. We are part of the resilience of community because we're pretty adaptable, actually, as a system. So we not only have an actual team working on mental health, which is called the Stress and Resilience Team, very well-trained, very good professionals scattered across the state who can offer training in suicide prevention called QPR. We can also offer mental health first aid. Some of that is for adults, some of that is for youth. So we do have professionals trained in those evidence-based initiatives. We also have staff and people trained in behavioral health. Brad Dirks, who's been a specialist, who's been interviewed on your program before. Brad is our behavioral health specialist. He's also an instructor and associate clinical director of K-State's Physician Assistance Program. But more importantly, our faculty in the field are keen observers of the community strengths, of community resilience, but they're also aware of maybe some of those ripple effects that aren't being dealt with very well. I think you talk to any of our faculty specialists such as myself, and we keep an ear to the ground about what is going on out there, what are some of the touch points. I get the privilege to serve on a couple of state suicide prevention committees and the State Suicide Prevention Coalition in the state. And those two groups are very keenly aware that we need to booster our skills more and our ability to communicate across communities and across offices and workplaces because there are people suffering and hurting out there. And if we don't communicate, we won't be aware, we won't be able to offer help. Kansas Pride, which I am a Kansan. Kansas Pride is really good. We're self-resourceful. We are people who see the best parts of the prairie and persist. We don't typically ask for help. So it takes those key informants in the community, such as Extension, public health, faith community, business people, to notice a friend is having a tough time, be it a friend who's a teenager, a colleague in a workplace, or somebody in our faith community, to reach out and just give a friendly word of, how are you doing today? And be ready for the answer, because it may not be as easy as what we think, but at least we'll be there and we'll be willing to help out.
That's the Kansas Health Foundation's Distinguished Professor of Health at Kansas State University, Elaine Johannes. To learn more about healthy living, contact your county or district extension office. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wickman, and this is the K-State Radio Network.